Tonight, we turn the spotlight on the Social Health Authority that hosts the Social Health Insurance Fund, SHIF, and two other funds, Primary Healthcare Fund and Emergency Chronic and Critical Illness Fund. Come March, Kenyans will start paying 2.75% of their earnings to the authority, with the government banking on this to realize its UHC dream. On the first episode of The Heartbeat tonight, we go to the ground to understand Kenyans' hope and fears on the new health insurance scheme that has replaced NHIF, with Lois Wangoi and Lilies Njeru.
Nandi Road has established itself as a healthcare hub here in the county of Uasin Gishu. It has it all, many hospitals as well as medical training colleges. And so for this conversation on matters SHIF, it was critical for us to land at Nandi Road and get Mwananchi's perspective. Granted, many who use this road are interacting with the country's healthcare insurance system and in real time.
Sasa napenda SHIF ikuwe isidiscriminate familia kutoka mtoto mpaka mzazi, kila mtu apewe nafasi ya kutibiwa. Ikuwe wewe ni mzee ama kijana, bora ni familia, hiyo family moja. Hata kama ufikisha 18 na bora uko kwa hiyo familia. Mfano sasa mimi watoto wangu wote wenye niko nao, hata kama wako na miaka ngapi na bado wako kwangu, ajeoa na ajeolewa na ako kwangu. So nataka hiyo SHIF isaidie kukava hawa.
A sizable number of those who frequent Nandi Road for treatment are those from neighboring counties. We meet with Joel Tarus from the neighboring Nandi County.
Matumaini yangu wa SHIF ni kwamba kila Mkenya awe ndani na pia waweze kutibu kwa every level, na pia wasilimit mambo ya pesa. Unajua NHIF ina limit, nasema ikifika kiwango fulani una top. So ile SHIF isifanye mambo ya limitation ya malipo, wafanye tu comprehensive kwa kila Mkenya, na government it take over treatment ya watu, it take over fully, sababu NHIF imelimit watu wengi sana, hata mtu anaweza kufa sababu hana pesa.
The NHIF fund will cease to be operational this year and SHIF will take over. A majority of those we spoke to mentioned efficiency as their number one ask for the incoming SHIF, even as they seek better understanding of what it really is.
Sasa shughuli ya SHIF hapo kidogo tunahitaji mafunzo juu. Inaweza yatuelewe.
Sasa hiyo ndio swali nauliza, mbona wanataka kuwatoa wapeleke kwa SHIF ni kwa nini? Na hata kwa SHIF yenyewe ijetusaidia wengi wetu. NHIF kama sisi Western, mtu aenda anakaa kwa laini anasema bado hajamajua. Sasa hiyo swali tunataka kuuliza, how?
The 2.75% SHIF deduction for salaried Kenyans has not been capped at a maximum of 5,000 Kenyan shillings as promised earlier by the government, a move that will see deductions from top earners rise sharply, while individuals in the informal sector are required to remit 300 Kenyan shillings on a minimum under SHIF.
Wananchi wanataka katu ya 300. Hapo wananchi kuna wakulima wanapata billions of money. Mtu anavuna mahindi anapata over 100 million. Still you still expect that person to pay 300. So this unaona kama sisi wafanyakazi wa serikali, it is unfair to us.
From here in the county of Uasin Gishu, we move to the county of Nairobi, where my colleague Lilies is holding brief with yet another key stakeholder. Here is Lilies with expert opinion on SHIF.
Indeed, Lois, as we navigate through the contentious transition from the National Health Insurance Fund, NHIF, as we have known it for the last 57 years, to the Social Health Authority that hosts SHIF and other two funds, there are questions about what you will be entitled to under SHIF. So far, the government hasn't been able to sufficiently answer this question, beating around it at best.
We're going to have a benefits package. Benefits package simply means this is what your entitlement is. For example, if you go and have this procedure done, for example, the fund will pay up to 100,000. You might find there's a public hospital and a mission hospital for whom the 100,000 will suffice. You might find there's a high-end private hospital where they'll be demanding 300,000. It is your choice to decide where you go. If you want to be able to top up and be able to get this higher-end care where most of the time it's not medical care you're paying for the hospitality component and the ambience.
It is important to note here that the 100,000 shillings Dr. Lwen refers to is not the actual benefit. In fact, he says the real benefits will be determined by the financial projections after the regulations are finalized and gazetted. In essence, this means lipa kwanza mengine tutajulia mbele.
If we projected that we were estimating we wanted to get 100% of the population, and they turn out at 50%. You can see what that does to the numbers.
This has upset many people, that a health scheme has been designed and citizens will soon be forced to pay for it, albeit blindly, because what the benefits are is unknown, or when the benefits kick in, still unknown.
2.7% of a gross salary, a gross that you never take home in the first place. Then you are being told also as a healthcare worker and civil servant that you give your 5,000 shillings medical allowance also into this program. And nobody is assuring you that after all these payments, you can get a comprehensive cover. Instead, they tell us in Schedule 5 of Transition Clause that you can then go to your employer to get you a medical cover. My employer's government.
What we know for sure is that the SHIF plan has done away with the comprehensive cover, which was a key benefit of NHIF, especially for civil servants. Doctors are not happy about this.
We are the ones on whose backs UHC will be rode. We are the ones on whose backs we are going to achieve the SHIF and all those things. So if you can't take care of us, if we are offering services that we can't afford ourselves, then what are we doing? Who cares for the carer?
Despite the unanswered questions and resistance from professional bodies, the government continues with public participation and says that mandatory contribution to the fund will begin next month on 1st of March. The regulations state that individuals will be required to register for SHIF before accessing any government services. However, while lifting the order of the High Court that had stopped the implementation of Social Health Authority, the Court of Appeal ruled that these 3 sections remain suspended.
It also means that the obligation for employees and other Kenyans to contribute to this new social health authority, will now take effect. It will continue to take effect. So that means then that people will, those who are registered previously under NHIF, have to apply and re-register under the Social Health Authority.
For now, NHIF contributions still continue, though NHIF's assets are now in the Social Health Authority's control. And with just 2 weeks to go before the SHIF contributions kick off, it remains unclear why the government is pushing to implement this transition without clearly defining the benefits. Lilis Njero Mutinda, NTV.